आज का जो नेक्स्ट लेक्चर है दैट इज अबाउट टाइप 2 डायबिटीज। ओके, हमें पहले लेक्चर में पता भी चल गया था कि टाइप 1 डायबिटीज क्या है, टाइप 2 डायबिटीज क्या है, टाइप 1 डायबिटीज किस लिए होता है एंड टाइप 2 डायबिटीज किस लिए होता है। ठीक है, तो पता है। तो व्हाट इज द डेफिनेशन अगर हमें लिखने को बोले, दैट इज टाइप 2 डायबिटीज इज अ कंडीशन वेयर योर बॉडी कांट यूज इंसुलिन प्रॉपरली। मीन्स पैनक्रियस के बीटा सेल से इंसुलिन तो सिक्रेट हो रहा है, पर इंसुलिन जहां पर काम करना चाहिए वो नहीं कर पा रहा है। सो दैट इज व्हाट इज नोन एज insulin resistance. Okay, so body can't use insulin properly, and over time what happened, the pancreas can't make enough insulin to keep the blood sugar level in check. Okay, so this is a very simplified definition. Now let's move to the another slide. So what is the pathophysiology of the type 2 diabetes? So there is an insulin resistance, after there is an beta cell dysfunctions, and then will lead to the hyperglycemia. So if you go, what is the first initial step of the type 2 diabetes? It is about your insulin resistance. So it is an initial steps. Okay, so pancreas is secreting insulin from the beta cell after seeing the blood sugar level is high. So but there are some insulin receptors which is present in the muscles, which is present in the fat and the liver. Okay, so कुछ receptors होते हैं मसल्स के सेल्स के, आउटर बॉडी के सेल्स में, फैट में, लीवर में। देर आर सम रिसेप्टर्स जिनको हम इंसुलिन रिसेप्टर्स कहते हैं, IR, दैट इज योर इंसुलिन receptors. And they basically, insulin receptors, they are located where? Now this insulin receptors, they are located in the surface of the target cell. They are located in the surface of the target cell. Okay, so surface of the fat, surface of the fat, surface of the liver, and the surface of the muscles. Now suppose, for example, this is liver, and here this insulin receptors are present. Okay, now the insulin which is coming out from the pancreas, they can bind here, they bind with the insulin receptors, and they trigger some activities. Okay, now that activity which is known as some tyrokinase kinase activity, now that activity help in the glucose enters into the cell, the target cell. Okay, so in hyper, that is in type 2 diabetes, even if the receptors is binding with, even if the insulin is bind with that of the insulin receptors, but it cannot activate. So if the insulin receptors cannot activate, अगर activate नहीं होता है, then what happened? The glucose cannot enter into the cell. Okay, so suppose this is glucose. Okay, so suppose these are the glucose. Okay, and let me draw in another way, and this is your insulin. Okay, now this is your insulin. Normal physiology, what it say, this glucose is enters into the cell with the help of the insulin receptors. Here what happened, this insulin receptor is not activated, it is not working. Okay, and this glucose enters into the cell only when insulin get activate the insulin receptors. Insulin is there, glucose is there, this receptor is not activated. As a result, what happened, glucose cannot enters into the surface, into the cells. So there will be a increase in the glucose level in the blood. Okay, and also there is increase of insulin level also in the blood. Okay, so there is hyperglycemia and also the hyperinsulinemia. Okay, so this two things are there. There is an increase in the glucose level and hyperinsulinemia. Okay, so what has happened, the insulin bind to its receptors, but the glucose transport into the cell is impaired, As a result, the glucose cannot enter into the cell. Now what happened? The cell becomes starved. Okay, they are not getting the enough glucose. So they are telling the body we need energy. So to compensate this, what the liver will do? The liver continues to produce glucose. Liver और glucose तैयार करता है. सेल भूखा है, उसको वो स्टार्व कर रहा है, उसको उसके पास एनर्जी नहीं है, उसके पास ग्लूकोज नहीं है. सो क्या होगा? लीवर दे प्रोड्यूस मोर एंड मोर ग्लूकोज, जिनको हम ग्लूकोनियोजेनोसिस भी बोलते हैं. ओके, सो ब्लड ग्लूकोज लेवल हाई है बट सेल के भीतर वो जा नहीं रही है, तो लीवर क्या कर रहा है? उस चीज को कंपनसेट करने के लिए, अरे उसके पास सेल को नहीं है, वो उसको खाना नहीं मिल रहा है, दैट मीन्स उनको ग्लूकोज चाहिए, देन इट स्टार्टेड टू प्रोड्यूस मोर एंड मोर ग्लूकोज. Now there is more glucose. Now pancreas is saying, "Arey, I am there is a glucose increase of glucose level in the body. Then I need to push more and more insulin." So pancreas, with the help of the beta cell, it secrete more and more insulin, which is called as your compensatory hyperinsulinemia. This phase is called your pre-diabetes stage. Okay, this is very important. Okay, this is called pre-diabetic state. Now come to the fourth one is your beta cell dysfunction. So obviously, if the beta cell is over functioning, overwork in the later stage, what you will see, there is inability to produce more insulin from the beta cell. It becomes exhausted. Okay, so there is an pancreas, a beta cell of the pancreas that releases the insulin in a pulsatile manner. Okay, in a pulsatile manner, because beta cell is exhausted, so that loss of the pulsatile insulin is released. Okay, so there will be a chronic high blood sugar level. Okay, and if you go with the blood test report, you will see that the elevated free fatty acid, so that lipolysis. Yeah, in the last video I've told you how the lipolysis has taken place, how the ketone body formation is there. Okay, so there will be chronic high blood sugar level and elevated free fatty acids. Okay, now obviously the liver is become insensitive to insulin because IA, that is insulin receptor, is not working. So liver produces glucose, and which further raises the fasting blood glucose level in the body. Now decrease incretin effect. Now what is incretin actually? So incretin is a gut derived hormone. Okay, so it is a hormone which is present in the gastrointestinal tract. It's in the gut hormones, and this gut hormone is released after eating. Okay, so after eating, this gut hormone is released. So what is the function of the incretin effect? What is the function of the incretin hormone? It stimulates the it it stimulates the insulin secretion. Okay, so whenever we eat, there is a formation of the carbohydrate which converted into the glucose. So they, to depresses the amount of the glucose, gut hormone release, which stimulates the insulin secretion. Okay, they suppress the glucagon. They suppress the glucagon. So, and increase the satiety. Okay, so you don't have to eat more and more. Okay, so increase the satiety. To stimulate the insulin secretion, suppresses the glucose, and increases the satiety. Okay, so this is, so in what happened in type 2 diabetes, the gut hormone activity, that incretin activity decreases. As a result, incretin usually enhance the insulin releases after the meal. So when its activity decreases, obviously this effect get blunted, and there is a less insulin secretion after the food intake. Okay, so when, remember one thing, when glucose is given orally, so suppose if you give glucose, if glucose is given orally, the effect of the incretin is more. Okay, so there may be a insulin secretion is greater. Insulin secretion is greater. But if the same glucose is given in the intravenously, the insulin secretion is lesser. Why? Because incretin is found in the gut, okay, in the GIT. So that is why in type 2 diabetes, the clinical prevalence is that incretin effect is reduced. So there are the two drugs which usually given to decreases the, that is, sorry, to enhance the incretin effect, to increases the, to enhance the incretin effect, the two drug is given. One is known as your sitagliptin, and the other is your liraglutide. Okay. What is incretin? Incretin is a hormone which is present in the gut. They help in the release of insulin secretion after the eating, thus depresses the blood sugar level in the body. In type 2 diabetes, is incretin effect reduces. Okay, to enhance the activity of the incretin effect, two drugs are used. One is your sitagliptin and other is liraglutide. Okay, so beta cell activity decreases, but in pancreas, alpha cell activity increases, which secrete more and more glucose, which raises the blood sugar level in the body. Increased renal glucose reabsorption, kidney reabsorb more and more glucose instead of excreting it, which resulting in the hyperglycemia. So this is a summary. There is a decrease in the insulin secretion due to the beta cell failure, increase in the glucagon from the liver, from the alpha cell of the pancreas, increase in the hepatic glucose productions, decrease of the glucose uptake from the muscles and the adipose tissues. There is an increased lipolysis, decreases the incretin effect and increases the renal glucose reabsorption, and at last brain insulin resistance. Okay, so this is the summary of the type 2 diabetes. Okay, so basically it's a pathophysiology. We already know what are the sign and symptoms of the diabetes. Okay, in the next class we will do some multiple choice related question along with the treatment options. Okay.